I discussed about morphine in my videos, and there are so many questions still arising about morphine. And I have seen that, like some scenario, like you are in your pain, your wound is infected with the worms. 24 hours you are in pain, but the caregivers and patients are not ready to take morphine, and because they are in a fear that it will cause some sedation, or morphine is not morphine, what is used for pain relief. So many questions are there. Will the patient on morphine be sedated for the rest of life? Will morphine not cause addiction? So many questions are there. First question is, not morphine, what is used for pain relief? Morphine is only one of the drugs that are used to relieve pain. Morphine does not work in all pains, and you have to note the point that morphine does not work in all pains. Only about 2/3 of all pains can be adequately treated with the morphine. We can't treat all pains with the morphine. It's like only 2/3 of pain can be adequately treated with the morphine. It is important that the type of pain is identified and appropriate drugs are used. We have to identify the type of pain. Then only we can use morphine. And morphine is seldom used alone. It is combined with the other painkillers, depending on the type of pain. And you have to note the point that we have to use morphine with other appropriate painkillers depending on the type of pain. If morphine is used in pain that are not morphine responsive, it will only make the patient sedated and cause side effects. Again, you have to note the point that if morphine is used in pains that are not morphine responsive, the pain is not morphine responsive, it will only make the patient sedated and cause side effects. And another question about this morphine is, will the patient on morphine be sedated for the rest of life? While hearing the name of morphine, the first question from the caregivers and patient on my experience will be, will the patient on morphine be sedated for the rest of life? No, certainly not. If morphine is used in morphine responsive pain in the right dose, not the point, only the licensed person have the right to prescribe morphine. So if the morphine used in morphine responsive pain in the right dose, it does not cause sedation. If we are using the right dose, it does not cause sedation in the majority cases. In fact, the patient can often pursue a profession and lead a normal life while on morphine. I have seen a TV show, and I have seen a breast cancer patient. She performed well till her death, before 1 week of her end of life with this morphine. So, another question, will morphine not cause addiction? No, if properly used. If not used properly, medical science has clearly understood in the last few decades that if morphine is not used in doses adequate for pain relief, it does not cause addiction. The fear is totally unfounded. So another question is, so there will be no withdrawal symptoms if morphine is stopped abruptly. Whether we can stop morphine abruptly. So we will in next video we will discuss about whether we can stop morphine abruptly. Thank you.